Meeting on Families, Children, and Seniors will now come to order. Madam Clerk, would you take the attendance?
Chair Young.
Present.
Representatives Coffia.
Present.
Glanville.
Present.
Arbit. Edwards.
Here.
McDonald.
Present.
Wozniak.
Here.
Fox. Johnson. Thompson. Madam Chair, you have a quorum.
Very good. And I need a motion to approve the minutes of our March 21st meeting.
So moved.
Who said that? Okay, all right. I'm like, I looked that way and she said that. Okay. Representative Coffey, yes. All right, and for right now, we're going to go at ease at the call of the chair. I need to go again? I don't have to.
No, just reconvene the meeting.
All right. We are now reconvening committee. Thank you all for your patience. So I'm excited to have our guest on today to provide us with some information on the Children's Services Administration for the Department of Health and Human Services. We have with us Deputy Director Demetrius Starling. Director, catch your breath. I know it took a minute, but we're so glad to have you here on today. Feel free to get started whenever you're ready.
Thank you, Rep. Young. And again, excuse my lateness here. Chose the wrong building. I was in that building earlier today, so thought I was there again this afternoon. So thanks again for having me, and thanks for allowing me for the space here. First and foremost, I really want to highlight the priorities that the department has deemed to be paramount for the last several years. And I think that it's extremely important for me to level set and provide that context, because I think it gives you a true glimpse of some of the transformative work that we've done over the last couple of years and some of the work that we're looking to achieve over the next couple of years here. So with that stated, here is a slide that we generally use in our presentations, both internally and externally, to kind of highlight and showcase some of the work that we're doing. So the first priority here that we have set is ensuring equitable practices in child welfare. And when people read that, sometimes they think just about what it means for our children and families, but also it means some of the work that we're doing around our staff as well. So making sure we're looking at policies, practices, making sure that we make sure that everyone within our state feels included and a part of this inclusive transformative change that we have within our systems. Next is timely reunification and permanency. I think it's incumbent on all of us to make sure that if and when children come into our care, that we're doing everything within our power to get these kids back home safely as quickly as possible. So this takes some really good collaboration, some really rich discussion, not only within our department, but also externally. So we're talking about our jurists, we're talking about our private agencies, to make sure that we're really leaning into making sure that our kids are returned home safely, timely, with the right services intact. Next, we have keeping children safe with their families. I think that some of the work that we've done, I'm really proud about some of the work that we've done to really look at a more robust array of community placements for our kids, and also keeping kids safely at home with services. So when you think about prevention and preservation services, things that we can do to kind of work upstream to keep our kids at home safely with their families versus bringing those kids into our systems and keeping them away from their communities. Lastly, safety and well-being of kids in care. Again, I don't think it's rocket science that it's our obligation to make sure that if and when kids are removed from their homes, that they're just as safe in a foster home, a congregate care facility, and any other provider care that they would have been in their own homes. Next, this slide speaks to our child welfare continuum of services. So within Children's Services Administration, we have 83 counties that we have state-administered programs in. We have 5 business service center regions throughout the state, ranging from our UP down to Southeast Michigan that we cover services over. We have approximately 3,614 local county and central office staff that are doing child welfare work for us. And we also contract with about 58 agencies to provide prevention, preservation, adoption, licensing services for our families. Some of the work that we're really proud of right now is our front-end redesign, which gives this human-centric touch or feel in regards to children's services work. So it eases the work for our staff. It allows them to be out in the community more, working with their families, so the systems don't burden them down and keep them tethered to a desk, and make sure that they understand that the work that we're doing is extremely valuable and extremely important as far as having boots on the ground. So we have new efforts to prevent children from coming into our child welfare systems and our juvenile justice systems, more specifically around our Families First Preservation Act work that we're doing, which I'll touch upon later. Also making sure that not only folks within our our department, but also externally understand how important it is to keep kids at home safely with services versus tearing those kids from their communities, from their homes, and bringing them into foster care. If and when kids are, of course, brought into foster care, there is a court order that is required for removal and placement of those kids into foster care. And for reunification or termination of parental rights, a court order is also needed. We always strive for reunification. That is our major number one goal when it comes to kids who are removed from their homes. And if reunification is not possible, other options for permanency are then explored. So some of the work that I'm extremely optimistic and happy about for the last couple of years that we've endeavored into is prevention indicators for success. You all have heard, of course, of Families First, our Preservations Act, which was a landmark legislation act that was enacted recently, and most significant child welfare change in about 20 years, to be honest. It allows an opportunity to receive Title IV-E federal matching dollars for certain prevention programs. Prevention programs must be listed on the Title IV-E Prevention Series Services Clearinghouse. We currently have 10 services within our clearinghouse, which is a lot more than other states. I think that we really did a really good job as far as digging deep and doing an environmental scan in regards to what services were needed, not only for some of our communities that we normally work with, but also some of our tribal partners. We had them give a lot of feedback in regards to what services they thought were necessary or needed for our families. The children and youth receiving the services must either be at imminent risk of entering foster care or be a pregnant or parenting foster youth. Parents and guardians of these youth are also eligible to receive services, and it provides an opportunity for states to dramatically rethink how to serve children and families. It creates an impetus to focus attention on prevention and strengthening families as a primary goal rather than foster care placement as a primary intervention. Since being approved by Governor Whitmer, the prevention plan was submitted for federal review and approval on 8/13 of 21. Next, I want to talk about Children's Protective Services, which is a program that's near and dear to my heart. I've been with the department now for about 24 years. I started my work here with the department as a CPS worker in Wayne County, and I found it to be truly enlightening and very engaging work because it gave me an opportunity to have that hands-on approach with my customers, also to provide them the services and impactful guidance that was needed to hopefully keep them out of our systems going forward. So the program goal for CPS, we investigate complaints, of course, of alleged child abuse or neglect, and we assess and ensure the safety of the children, provide families the services and supports as needed. CPS investigations, for the most part, as indicated by policy, is typically 30 days. And in open cases, concerns are typically resolved within 6 months for an open CPS case. On average, we average about 14,500 reports of suspected child abuse and neglect every month. And CPS involvement begins with the call to centralized intake. From there, a specialist will determine if the information received during the call warrants an actual CPS investigation being initiated. Calls can be assigned, rejected, or transferred to another agency, hopefully more likely to prevention services. If assigned, the information is sent to the local office for investigation. Investigations, of course, can be denied if there's a lack of evidence to support that child abuse or neglect actually occurred in the home. If there is evidence to support the allegations, the investigation may be opened and services rendered at that time. In cases in which a child or children are found to be at imminent risk, a petition may be filed with the court to remove the child from the home, and the case is then, of course, transferred to foster care. So with foster care, the program goal, of course, is to ensure the safety, permanency, and well-being of our children, which are, of course, federal indicators, and to make sure that kids that are placed under our care and supervision receive all the services and guidance that's needed. And so I just want to pause here to to really talk about some of the sometimes chaotic and traumatic experiences that happen at the beginning of a foster care case. There is no time to deal with scheduling woes or complicated delayed referral processes in a lot of these instances. We're trying to get services in place at a time when parents are really going through the worst times of their life. Kids are traumatized by removal, as I'm sure you all are aware, and they're in crisis. In some situations, they're put into a stranger's home, and they are really confused about what's going on in life. So we need a quicker and easier referral process or a way to address the needs of the families and the kids going forward. With child safety being our top priority, opportunities such as our prevention programs assist in reducing the number of children in care. However, children still sometimes need to come into care if they can't be kept safe in their homes. And that's the stark reality of it. So I talked earlier a little bit about permanency goals for our children in care. So first and foremost, reunification of the children with their families is the number one preferred goal. However, in some instances, that's not achievable. So we look at other options for the youth. Adoption requires termination of the parental rights of the parents by the court. Also, we have guardianship programs that these kids can potentially find themselves in. Permanency placement with relatives. And again, I just want to put a pin in that for a second to talk about some of the great work that we're doing around kinship care. And Rep. Young, I think I appreciate you being a part of a lot of good, rich discussion around kinship care and family findings. So I think it's important and incumbent on us to make sure that if and when we remove kids from their homes, that we're doing really diligent searches to find these relatives, right, first and foremost, and match these kids up with familiar-like settings. So I'm really proud to work with New Foster Care and Second Chance and others as we try to lift up this programming around kinship care. The next one is another planned permanent living arrangement. So you can have permanent arrangement with a foster parent and independent living, which again is a major tenet of a lot of work that we're doing right now. We've had some really good discussions with external customers as of late who are trying to lift up programs to make sure that they, find a good route for success for older youth as they transition out of foster care. We all understand that some of the disparities lead to overall disproportionality in our systems. So making sure that kids have an easy pathway to mental health services or housing or to get a car or employment, things of that nature, we're really trying to really lean into this and provide a lot of guidance and support for that particular demographic. Next, we have adoption and post-adoption supports. The program goal is, of course, to ensure a safe, permanent, loving, adoptive home for each child that becomes available for adoption. Approximately 2,800 children a year are legally free for adoption with the goal of adoption. They occur through termination, of course, through parental rights, and our department contracts with 48 licensed adoption agencies. We also have an adoption and guardianship assistance office, and we have a post-adoption resource center. And at this point, I would like to make my obligatory plug that for any one of you who are interested in being either a foster or adoptive parent, you can always reach directly out to Sharday or myself to receive more information. And we have a wonderful event every fall in September to really showcase and spotlight some of the kids who are available for adoption. So it's an open invitation for anyone who would be willing to be a part of that day. We'd love to have you. Next, I just want to take some time to talk about juvenile justice reform. Again, I'm really proud to be a part of conversations that the governor's office and my department is really leaning into in regards to juvenile justice reform. The program goal is to ensure that all youth and families of diverse populations involved in Michigan's juvenile justice programs have equitable access to a continuum of research and evidence-based services that provide rehabilitation opportunities in a safe, supportive, and respectful environment that honors the youth and family voice. And one of the things I really want to kind of uplift within this is that Within some of the objectives, we're looking to reduce some of the racial and ethnic disparities that we see sometimes in our juvenile justice programs. I've had the opportunity to tour a couple of facilities, and seeing black and brown kids who have been cycling through our systems, especially in the juvenile justice systems, really tugs at my heartstrings. And I think it's incumbent on me and my leadership team to find a better pathway for these kids, to make sure that we're really providing some efficiency, providing some opportunities for us to effectuate change, and also make sure that we improve our systems going forward. Not only just for these kids who are currently in our systems, but for kids who may be in our systems in the future. So we have right now a heavy investment in juvenile justice programs through our JJ recommendations. The Michigan Task Force on Juvenile Justice Reform was formed to provide recommendations to Michigan's juvenile justice system. Additionally, the Raise the Age legislation, which was enacted in 2019, increased the age to 18 for juvenile court jurisdiction, so we can provide some of those services for those youth at a later age range. We also have 2 state-ran facilities, Bay Pines and Shawano Center, which serve over 70 youth with really complex behavioral and mental health needs. So right now we're looking at different ways to provide enhanced services and also boost our census. I know that staffing across the board, not only with our department but across the state, has been the bane of our existence, but we're really optimistic about some of the things we have in place to bring more staff on board to help build our census in those 2 facilities. Also, our Child Care Fund, which is the primary statewide juvenile justice funding structure, which provides financial incentives for youth to remain in the community, given that community-based and residential placements are reimbursed at that same 50% rate. So the expected impact of this is to see a reduction in the use of seclusions and restraints, as you all know very well about our JCAR rules that were enhanced and changed to rid ourselves of seclusions and restraints. Also, to ensure all youth and families involved in the juvenile justice system has access to a continuum of evidence-based systems and services, and also provide rehabilitation opportunities in a safe, supportive, and respectful environment. So this next slide indicates our current placement array development that we have in place. So the first one talks about therapeutic short-term treatment services. So again, it is a short-term intervention that provides services and support not only for our youth, but also to those parents who are taking those kids in. One of our foster parent surveys that we completed about a year ago stated that 75% of the people that turned in their license, it was for 2 specific reasons. One, because the financial incentive was not at the level that they wanted it to be, but also there were not enough therapeutic or respite services available for those kids that presented with a high acuity of needs in their homes. So these short-term therapeutic treatment homes, we feel will help us meet the needs of some of those foster parents and some of those youth. Our transitional placement program expansion, homes that kids can go to as we're looking to off-ramp those kids into community placements, and it really touches upon some of the services that they've already received as far as therapeutic services. It really lifts up those specific services and gives those kids a moment to breathe before they're placed back into their either parental home or another community setting. And also make sure there are some wraparound services in place for those kids and families before those kids are returned home. Same thing with community reintegration homes, just making sure that mental health stabilization services, making sure that services and support for those youth are in place as they either transition back into their home setting or independent living setting is in place before we make those moves. Enhanced treatment foster care, so we have Spalding and other agencies that are in WMPC that are providing guidance around enhanced treatment foster homes. So again, an elevated rate, elevated services, making sure that kids who present with a high acuity of needs are actually matched up with homes that meet those needs versus cookie cutter services and homes that have not met their needs in the past. Again, expanding relative and kinship care supports, I can't speak about this enough. It's always been my thought that kids, if and when they can't be placed at home, they should be with an aunt or uncle or grandma or granddad who knows about the kid's trauma, who knows about the kid's background, right? So I think it's important for us to make sure that, we have this wraparound kind of concept where auntie, uncle, if you really want to take care of your niece, your nephew, or if it's an older sibling that wants to take care of their sibling, that we are really wrapping our arms around these folks and saying, what can we do to better keep these kids at home with our ongoing support. So I'm really, really happy to see that it's starting to build some momentum and traction across the state, and receiving support and guidance from other folks across the nation, like Second Chance, which has been extremely successful in Allegheny County with their concept, is something that we're going to continue to do. Also, child caring institution investments, as many of you all know, of course. Last fall, we were able to advocate for a $25 million one-time pandemic pay for the community, the child caring institutions, to help them through some really rough times, with the concept that they were able to bring on more beds to help us out, place those kids at that time. Also, 2 months ago, we issued a new RFP, which provided enhanced mental health stabilization and CC and DDI rates for our kids for some of these agencies. I think that it's incumbent for me to continue these conversations, and I've done just that with several agencies. I'm going to continue to go down the list and make sure I'm having these one-off conversations with agencies to see what can we do to help support you in this work. If you want to do a grant agreement, if you want to do some kind of proposal to provide to the department in regards to how you can bring on 5 beds, 10 beds, 15 beds to help us out at this time, I'm going to continue to have those conversations. And just a snapshot of some of the more successful conversations and dialogue that have occurred as of late. Spectrum, they've opened up one of their facilities where they're able to bring on 40 beds by June 1st. So those beds are allocated for juvenile justice secure kids, and also they're looking to reopen Davenport as well, which will also bring on 12 beds in the very near future. So again, I think that we have some examples of success so far, and I'm going to continue the conversations with numerous agencies across the state to see if and when they can bring on more beds as well. Okay. So that brings me, Chair Young, to the conclusion of my presentation. So I know I rifled through that pretty quickly, so I want to open up the floor for any questions you may have.
Thank you so much for that. Yeah, that's a wealth of information. I'm gonna try my best not to hog all the questions, but for others, I'm gonna go ahead and get it started with just a couple. Because we know that the goal when we look at having to remove children from their households is reunification. So I just want you to speak a little bit, Director, as it relates to how you support those families regarding the reasons the children had to be removed. Now we know that there needs to be some support in the household. You ended your statements just a couple of seconds ago with wraparound services. So if you could just highlight for us what it is that you do to support the families to help reunite them with their children.
Yeah, absolutely. So what we do to help support our families is that, based off of the parent agency agreement that's put in place when kids are removed from their homes, we really try to highlight some of those needs. So it can be anything that ranges from parenting classes, maybe some therapy, whether it be family or individual therapy for the families, and also having contract providers that can actually come to the homes and work with the parents. They can monitor their progress. They can make sure that any needs are met before reunification occurs. Yeah.
I know right now I am dealing with a situation. There is a young man, I just learned recently, that has been out of school the entire school year, And I ended up talking to a local, attendance officer, DPSCD, and I'm like, this kid, the home life is bad. The mother is, dealing with substance abuse, and he's been staying with a relative.
Right.
And the relative says, well, the mom's not helping us get the paperwork. I tried to enroll him. They kept asking me for all his paperwork. So I just didn't know what to do. So I threw my hands up in the air and didn't do anything but continue to provide him with a safe place to live, right? Food to eat, shelter, that type of thing. But now he's missing out on his education. So what I'm getting to is the attendance officer said, any adult can go and enroll him in school. You can take him up there. You can enroll him without all that paperwork. And guess who the adult was? It was me.
Oh, was you?
Because the person keeping them, I don't have time to take off work. You have all of this stuff going on. So over break, I went to one of my days and went to the local high school to try to get this young man enrolled. And unfortunately, he should be in 11th grade. He thought he should probably be in 10th grade, but as it turns out, he has 0 high school credits. Oh, wow. And so now we got to look at alternative schools and all that kind of stuff. But while I was there, this is the point, there was a MDHHS worker who was assigned to the school. And she said that whoever he's staying with should potentially look at getting temporary guardianship. And then with that could potentially become a foster parent and actually get some help with caring for the young man. So I told you that big story because in here it talks about the Guardianship Assistance Office. And I'm wondering, is that some place that we would recommend people that are dealing with a similar circumstance?
Absolutely. And, to the point also about the truancy, I know that it can be extremely frustrating because within our child protection law, that's not something that we normally investigate. And one of the more encouraging things as of late, we've had a lot of good discussion with the administrators in Wayne County, their superintendent and deputy superintendent about some of the work that we can do to help provide guidance for some of those cases where kids are tuning. So I just wanted to put that out there to you that we are working with those folks to see if we can provide some assistance outside of actual investigations. But yes, in those particular instances, if there is an identified guardian that can actually petition the court for guardianship, those are instances where they can actually go to the court and have that sign off and actually get assistance from our department for the GAP program, which I can hopefully provide information to you in your cohorts at a later time.
Yeah, that I'm absolutely gonna need that.
Okay.
Because when I took the information back to her, she's like, well, how do I do that? And I'm going, okay, let me find out. I have this wonderful guest coming to provide some information on Tuesday. So thank you for that.
Absolutely.
Representative Wozniak?
Yeah, please.
Representative Thompson.
Good morning. Thank you very much for your presentation. I have so many questions. I am in Downriver in Brownstown. So many questions. I don't want to take so much of your time, but I'm very concerned about what is happening at JDF, what happened to the child there. I know it seems like there's a lot of blaming and pointing fingers. Representing the county of Wayne, I know many of us do. What happened? Where did we go wrong? How did the ball get dropped? How did that happen to that child? What can we do to stop criminalizing our youth? I don't know if you're familiar with the school to prison pipeline.
Yes, I am.
Now I may be downriver and I may live in Brownstown, but that affects children in our community too. The criminalization of our children and putting them in a juvenile justice system when really a lot of their behavior is children being children or boys being boys, that they need the guidance of families and they need supportive services. They need their parents involved. They don't need, I feel like we have schools that are choosing not to involve parents. I kind of want to get your opinion on that too. They're not involving the parents because they say, we don't want to bring so-and-so's parent and so-and-so's parent because then they're just going to get into an argument when really the child's behavior is not being addressed by the parent or the child's parent that's being affected. Mm-hmm. And then the school says it's just better if we handle it. But then the next thing you know, the cops are getting called on that child, right, for misbehaving at school, and they're being suspended for multiple times, and it's 45 days, and they're missing out, and they come back and they act up, and this just repeats itself down. That's why they say the school to prison pipeline. So what types of things can we do as legislators to encourage more parent involvement in our schools? That would be one question. And then number two, what can we do with the situation at the juvenile detention facility in Detroit?
So to your first question, I think it's going to be important for us to really kind of wait for the JJ recommendations to kind of take flight. I think when you look at some of the recommendations, the initial recommendations from the task force, they're looking to see how we can have more community involvement and engagement. And that, of course, means engagement with the parents. It's hard for me to sit here and you know, paint a broad brush across the board in regards to parents and their lack of involvement or engagement. But I do think that the folks that we're bringing into the fold to have discussions around this can give us some pretty good ideas and remediations in regards to how we engage with our families, schools, our juvenile justice systems to have a more comprehensive look and view at those particular cases. In regards to what happened at Wayne JDF, unfortunately, because it's still in flight and there's investigations and things of that nature, I don't know how much I can, you know, really concisely speak about that right now. Again, as the department has stated, our thoughts and prayers definitely go out to the youth and the families involved.
Thank you. Representative Wozniak?
Thank you, Madam Chair. A couple questions. I really appreciate your testimony, your experience level, your compassion, your knowledge of what your department's doing. But I have couple of questions. How is the tracking and follow-up? I know we had problems with MySACWA. How is the tracking improved? That's the first question.
For our child welfare systems?
Yeah.
I'm really optimistic about some of the work that we're doing right now. I think that there were some learned, there were some things learned from our previous system, of course, and I think that we internally have taken upon ourselves to have more frequent touch points with our vendors and also internally to talk about any kind of bugs or issues that may arise. And we also have input from our staff. So we have staff that are testing our modules before it's a full implementation and rollout. We had our licensing module rollout last fall with, you know, a couple of, you know, fluctuations, but we were able to iron those bugs out pretty quickly. So we're really optimistic going forward that, you know, we've got a firm grasp of what's going on with this new system.
That's great. That's great. Again, your experience level is amazing.
Thank you, sir.
My second question was, the last report I got from the Auditor General is way back from 2018, but it required responses from your department and corrective actions by your department. Do you know if that ever occurred?
In regards to CPS?
Yes.
Yes. So there were a couple of things that, you know, we highlighted with that. So we have a supervisory control protocol. I think that was something that the auditors really found to be
That was one of the big ones.
Yeah, one of the big ones. So we have a system in place where there are routine check-ins throughout the life of the investigation where the supervisor has to go into the system to make sure that there were certain things that were completed before final completion or approval of those reports. And within that, we can see where there are areas of improvement, whether it be training, whether it be systems improvement for our MySACWIS or our CCWIS, but also just to make sure that across the board there's a sense of consistency across the state. I think back then there were certain things that as supervisors in certain regions and like in Southeast Detroit may have not seen or saw that other folks in different parts of the states didn't see within those particular investigations. So having a sense of consistency across the state with those investigations and how they're viewed is one of the things that we're really proud of. I think that was a huge check mark for us as far as that supervisory control protocol.
Yeah, I might have to contact you for the responses and the follow-ups because I couldn't find them. But if you have them, I'd appreciate it.
Yeah, absolutely.
And one last question: how are you dealing with Central Registry now? Have you got most of that cleared up with problems?
Yeah, we're still going through that list. Right now, I believe we have over 120,000 names that still have to be expunged as a result of our Central Registry changes. We have a contract with the University of Michigan who's also helping us go through those cases. We also have our expungement unit that's, doing their best at this point, but it's quite a heavy task for us to get through that list.
You have a difficult job, but again, I really appreciate your expertise, your effort, your enthusiasm, your compassion.
Thank you for your acknowledgement. I appreciate it. Thank you, sir.
Thank you, Representative. I do understand that the Auditor General is supposed to be compiling an update from the report sometime later this year.
Right.
So we'll be on the lookout for that.
That's correct.
Next up, Representative Edwards.
Thank you, Madam Chair. As a former child welfare specialist, I have experience with the foster care process, permanency, helping families achieve those goals, all the way through children aging out of foster care. I've done it all. I know you mentioned in your speech that there are 14,500 reports of suspected abuse. But I wanted to touch on the fact that in January we had a 5-year-old die, and we also can add in the example of the freezer mom. I wanted to know, what is the department doing to aid in changing the outcome?
Changing the outcome of child
of the
deaths.
fact that, child deaths.
So I think it's important to note that our staff are, of course, up against some really difficult jobs. And I think that our staff really do a wonderful job with their investigations. There are, unfortunately, sometimes where a child may die, and that's not an excuse, it's reality. And with those cases, what we do is we do a really comprehensive review to make sure we're combing through that case to make sure that we didn't miss anything. Are there areas of improvement that we could have really touched upon? Are there services that could have been provided to the family to ensure that that child wouldn't have died or got seriously hurt? Again, I don't mean for this to sound empty or baseless, but those cases really affect us. I mean, it's our hearts, our thoughts go out to those families, and unfortunately, in some circumstances, kids unfortunately die, and that's not an excuse, but it's just the reality of things. So again, what we try to do is evolve our systems so that if and when we can effectuate any change and that we can prevent any children from being hurt or killed, we're going to do just that. We have a system of safe review that we do on a lot of our cases. So if there's a particular case that we really need to kind of go back and do a look in time to see where we touched this family, what services we're providing, where we could have done better, we'll do that. And we'll continue to do that. That's a pledge that I guarantee you from my chair that we'll continue to do. Whenever there's a kid that's hurt, either on our watch or not on our watch, we'll look at those cases to make sure that we provide the right support for our communities.
Well, I do hope one day soon that there's more conversations on reducing that number, because right now it's like one child dies every 5 days. That's a huge problem.
Yep. I can't disagree with you.
Thank you.
Thank you.
Representative Coffey.
Thank you, Madam Chair, and thank you, Director Starling, for coming in today. So I was focused on your slide about placement array development. Excuse me, it's one of the last slides, and the second to the last item was about expanding relative and kinship efforts. I'm a former county commissioner, former Head Start social worker, but I became aware in Northern Michigan of the kinship care issue. I had grandparents approach me. Often it had to do with, unfortunately, family members falling prey to opioid addiction, and there being neglect because of that, or perhaps even death or incarceration of the parent due to the addiction issue in the cases that I dealt with. But long story short, they brought up the issue of informal kinship care and the challenge that they would face as the family who, the child, ideally the child is able to stay connected to relatives, as you mentioned earlier in your presentation, but the fact that if it's an informal living situation where they don't get legal guardianship, that they don't qualify for a lot of the financial assistance. And these grandparents would share many times, they're spending their limited resources, fixed incomes many times no longer at working age. And this is not unique to my area. It's all over the state where these grandparents and other relatives are taking on the financial ramifications of caring for children who have been traumatized and need additional services and just are growing and it's very expensive, to give them the care they need. So kinship care seems like an important piece of this puzzle as we are trying to keep children connected to their loved ones and help get them through a very difficult crisis successfully. So this is a very long way to ask the question, what is the department looking at? What can we do to address that issue of not having access to the financial resources through the state agencies that they might even get through if they were in a formal foster care situation, right? Do you kind of follow where I'm going here?
Right.
The kinship care not getting the financial support that they need to successfully support those kids.
Right. So I want to make sure that delineating the two, because I think that we've seen some of those informal kinship care situations. As a youth growing up, one of the things I knew in my community was that we had folks, whether it be an aunt, an uncle, or someone down the street that was close to your family, that would step up to the plate and take care of that family as needed. So I know those things are happening informally behind the scenes. I don't know how much purview our department would have over that. But speaking to the kids who are actually in our systems, we have supports and services in place. So, for instance, we have kinship care navigators that can help provide that support to our kinship care providers. And I can provide, we may be in our fact sheet, but I can certainly provide that information in regards to the kinship care navigators and what they do in that realm. We also provide financial support, concrete support for those families if they're taking care of their kids. And on the front end, when kids are brought into care, what our staff are required to do is do a genogram. So it basically outlines all the connections, all the systems that our kids are connected to. So it'll talk about grandma, granddad, everyone that they know is connected to this kid. And we routinely go through the case file to make sure that we're updating that accordingly, because there may be an aunt or uncle from Arkansas or a cousin from Illinois that steps up. And so we'll vet that out to see if these are potential placements for these kids. Right. So there are supports in place for those families that are in our systems. It's kind of difficult for us to have more control over some of those informal processes that are taking place in some communities.
May I do a follow-up? Thank you so much. So I think what I'm talking about is specifically where it's grandparents, aunts, uncles, extended family who take the children and they're going through usually some sort of a court case, and they come to a fork in the road of, do we become official foster parents or do we just take them into our home as unofficial kinship care? But they are providing that long-term care and support for the children, so food, medicine, school supplies, therapy, etc. Right. And so I understand that there's funding for navigators, but as far as direct financial support for the families to pay for all of those living expenses and care for the children, what currently is the status and what might need to be done to increase?
So currently we, to be frank, we don't have all the structure in place right now for our kinship, a true kinship model. We're working towards that. Our definitions have changed as of last year. We have, supporters here that are steadfast advocates for that. But we're able to provide some supports, but getting some of that enhanced support for those folks is what we're truly working towards right now. We have the kinship care navigators that can assist them again with the concrete supports, economic supports, but we need to step it up. We need to do better. I know that we're trying to get to the point where these folks feel as if they're just as inclusive and part of our programming, such as foster parents and adoptive parents. Am I answering your question? I'm sorry.
One more question. Go right there.
Just thank you for all of that. And I guess I'm wondering if, again, as we're looking with real challenges with the foster, the number of foster care parents and trying to keep them out of juvenile hall, et cetera, this seems like such an important piece of the puzzle. Has the department done a financial assessment of what it would cost to actually get the cash assistance that is needed for these, it's, $50,000 or more kinship care families across the state. Is there a dollar figure, and is there a conversation happening around the budget to try to get that done?
I'm almost positive that we've done a financial analysis of that, but I can check to make sure. I don't want to misspeak to make
If
sure.
you would, and follow up and
Absolutely.
share that with the committee, I'd appreciate it. Thank you for your patience, Madam Chair.
No, that's fine, because I want to just jump right in there. So the work of the Child Welfare Improvement Task Force, our very first hearing that we had, that's who came in and presented before us. And one of the recommendations that came out of the task force was the family finding pilot, right? That we want to do that around the kinship, and then the Kinship Advisory Council. And so some of those questions that you're asking, we plan to answer through this advisory council. That's one of the things they'll be tasked with looking into. And so we continue to seek support on that. I feel like it's a meager ask of just over $600,000 to get that work done. We have one of our task force members sitting here in the audience. We've worked on this long and hard, so we're going to continue to push to get that across the finish line. But I do believe that that will help in terms of getting some of those answers and us being able to find the best ways to address those issues in particular. Now go ahead.
And to your point,
Yes.
I know that there is a meeting, an upcoming meeting with the two chairs of the task force to meet with Director Hertel and myself specifically on that to talk about the monetary piece behind that. So just to let you know that is in flight right now.
Excellent, excellent. And then I'll just end with this, because the task force is still alive and well.
Yes, it is.
And if there's anything that we can do to be supportive, outside of what we do here in committee, but in terms of the task force, be certain to let us know if there's something you want to share with us right now, but I'm not trying to put you on the spot. But we just need you to know that we continue to plan to move this type of work forward.
Absolutely. If I can really talk about one thing specifically that I think is going to be the proverbial next shoe to drop, is that providing supports and services for older youth who are transitioning out of our
Yes.
systems is going to be extremely important. As we pivot kids away from the juvenile justice systems and hopefully get them on a pathway to success, we understand that there are a lot of things from a disparity perspective that leads to overall disproportionality in our systems. So again, kids not having access to mental health services, kids not having access to, not to say kids, I should say young adults not having access to good paying jobs, education, things of that nature, it sometimes leads to our systems being overburdened. So I would hope that that's something that's going to be a paramount subject for the Child Welfare Task Force going forward. That is definitely something that, while in this chair, I definitely want to see some kind of transformative change because those youth, they really deserve better.
Yeah, that's a perfect way to end. You're right. I just talked to a 19-year-old on yesterday, and she was sharing with me her challenges. She happens to be a twin, and her twin she got placed in a good placement, but not so for the twin, right? You think, oh my goodness, so her twin is actually homeless right now, but then she has a place where she's staying, but she's just like, the place that she says is being held together by super glue, because her heating bill is $400 a month, and you already know what the stipend is or the allowance that they get. So just trying to pay the heat bill, pay the rent is subsidized, so that's not the problem. But it's everything else that eats up that allowance, and she's like, how do they expect us to live? Even with the increase, we still can't live, and the shortage of housing.
Right.
That's why her sister has the allowance but can't find any place to live. That's why she's staying here and staying there, and so there's so much work to still be done, particularly around helping our older kids who are aging out and trying to make certain that they get the resources they need to become successful.
I agree. Yeah. It's only so much that Chafee and MYOI funds can go towards,
Yeah.
and with not having as many housing vouchers that we would like for those aging out youth, any assistance or support from you all would be greatly appreciated. Thank you.
Very good. Okay, well, thank you. Thank you so much. Thank you,
thank you.
Sade. And with that, I need a motion to excuse absent members. Okay, okay. Did you get that? Representative Glanville. There being no further business before the committee stands adjourned.